It's that time again, Talking to Myself podcast. For all you new listeners out there, I'm your host, Carol L. Paur, the author of Is a Snorer Snores and Early Summer. September is like that uninvited party guest who comes to tell you the party is over. The days get shorter, the nights get longer. If you live in the Midwest, the days start getting cooler, especially at night. And for many, school has arrived. This September, I have one daughter who is going to college. The rest of my daughters are not going to any school this year. It feels strange not going to the store to buy back to school supplies. Labor Day is also in the month of September. Do you know what holiday that is? It is a celebration of American workers. I try to appreciate the work others do, such as people who work at the stores or factories to produce food or the items I want or need. September is also a time for people in the United States to think of 9/11 or September 11th. Do you know what that is? That is when we were attacked in our own country. So we honor that day as well. September is also National Suicide Prevention Month, and World Suicide Prevention Day falls on Saturday, September 10th. Such a heavy topic, right? It's something we don't want to think about. Everything is fine. I'm okay, you're okay. And then when it happens within your own family or friend group, it's as if a jetliner crashed out of the sky and landed right on you. I live in Walworth County, and I hear of suicides more frequently here than I ever did when I lived in Racine County. And I don't know why that is. Probably is because it's a smaller town and people gossip and we just hear more about these things. Many people are afraid to talk about suicide. We like to just kind of push it off, just like we do with our own health. Others think maybe our culture is too obsessed with it. Some people think there are too many mental health messages being sent out. There are over 45,000 deaths by suicide a year, and there are about 1 million or over 1 million attempts of suicide. Suicide is the 12th cause of death in the U.S. alone. Granted, it's not as high as heart disease with over 600,000 people dying, but I think we can be more aware to help prevent more suicides. Here to discuss this topic with me is Patty from the Walworth County Public Health Department. Thank you, Patty, for coming on to Talking to Myself. First, before we get started, could you pronounce your last name?
Patty Stritesky.
How long have you been with public health?
This will be my 22nd year with public health in Walworth County. I've been in this role with the division for 2 years now.
The World Health Organization has reported an increase of suicides in our entire world. Is this something that only happens in the big cities? Does suicide affect smaller communities like Walworth County?
Suicide rates have always been significant in Walworth County. We've specifically seen an increase in youth suicides over the past few years. To put that in perspective of what that means, from October of 2020 to August of 2021, there have been 7 adolescent deaths by suicide in the county. In comparison to previous years, from 2014 to 2020, there were only 3 adolescent suicide deaths. So in less than 1 year, we saw more than double the amount of suicides than we've seen in a previous 6-year span.
A lot of people want answers. They want to know why there are increases in suicide. Can we point to one thing and say, there it is, that's the problem?
I really don't think that we can specifically point to one reason or another. I think it's pretty complex, as you can imagine. First, nationwide, there's an increase in mental health illnesses, and we know that over half of adults with a mental health illness do not receive treatment. For youth, fewer than 1 in 3 with severe depression receive consistent medical health care. Second, lack of treatment can point to lack of access to care, especially in rural areas. There aren't enough providers to serve the need. Mental health care can be a financial burden, even if you do have insurance, and not having health insurance is a direct barrier to receiving any health care. Stigma surrounding mental health and suicide still exists. We need to be talking more about suicide and normalizing seeking care. We heard about lack of social connection for members of the community a number of times in our most recent community health assessment. Fostering community connectedness, we know for all members of the community, is an important protective factor in preventing suicide. Suicide is a community issue and it will require community response.
How much do drugs and alcohol play into all of this?
So in 2019, Wisconsin ranked 3rd in the country in terms of percentage of adults who currently drink alcohol. Data shows that consequences related to alcohol consumption are an increasing problem statewide. In our county, we're seeing an increase in emergency room and inpatient visits related to alcohol. Wisconsin youth are also beginning to drink at younger ages. The 2019 Youth Risk Behavior Surveillance Survey indicated that 20% of Walworth County 8th graders reported having at least one drink in the last 30 days. Opioid deaths in Walworth County have also been increasing. There were 21 opioid deaths in Walworth County in 2020. We know that substance use disorders often occur together with mental health illness. This can be due to the misuse of drugs or alcohol when they're being used in form of self-medication, and some substances can also contribute to the development or exacerbation of a mental illness. The risk for suicide is greater when someone is misusing drugs or alcohol.
When we met in July, you were talking about a suicide prevention program that you're trying to get into the county. Could you just tell us a little bit about that?
That's Hope Squad. It is a nationally known peer-to-peer suicide prevention program. It reduces youth suicide through education, training, and peer intervention. It is a program that is equipping our youth with coping skills and protective factors that they'll carry throughout their whole life. So in 2021, the Walworth County Board of Supervisors authorized the use of American Rescue Plan funding to support the implementation of Hope Squad in every school in Walworth County. Public Health served as a strategist and community connector, facilitating the program's establishment as a community-wide effort within the county. This is the first implementation of this model in Wisconsin. Hope Squad had previously been implemented in some schools in the county already. However, in March of this year, we hosted 2 advisor trainings, which included the training of 44 new Hope Squad advisors. So right now, we currently have 20 Walworth County schools implementing Hope Squad at this time. Implementation is at the elementary, middle, and high school levels.
So can you tell us a little bit about the Out of the Darkness event that will be Saturday, September 24th? Have you ever been to one of these events?
I have attended Out of the Darkness walks in the past. They're sponsored by the American Foundation for Suicide Prevention. So supporters, advocates, survivors, and family members are all in a safe community, supportive environment. Each walker can raise pledges And then in turn, those funds can go to support suicide awareness and prevention efforts. The walks that I've been at, there have been organizations and resources there at the event that visitors can engage with to learn more about things that are being done in their own communities. So whether that's resources or ways that they can get involved, it's all there together in one space.
What are ways we can raise awareness in general?
That's a great question. So talking about suicide and dispelling myths can be a great way to start. Go a little deeper, attend a suicide prevention training. Public Health offers a free suicide prevention training to the community. That training is QPR. It stands for Question, Persuade, and Refer. It's an evidence-based suicide prevention training where participants can learn more about recognizing risk factors, identifying warning signs, and learning how to respond to somebody in crisis. This year we've trained approximately 150 people in QPR. The more people trained in QPR, the more people in our community that can respond in a crisis and act. So like CPR, QPR is a way to respond in an emergency.
What can we do if we think or suspect someone is thinking about suicide?
Talk to them. Asking them about suicide is not going to put the idea of suicide in their mind. Talk with them openly, without judgment, and get them to someone who can help. Never leave someone alone that is in imminent danger of hurting themselves.
Thank you, Patty, from the Walworth County Public Health Department. On the screen are the various resources for NAMI and also the 988 number. Thank you for listening all the way through. This is a tough topic, but we just can't ignore it. Every day when I do my morning prayers, I have a special prayer. I pray just for suicide, for an end to suicide, and for peace and healing for those family and friends who have lost loved ones through suicide. Please check out this month's blog. Patty had a lot of great information that I couldn't squeeze into this podcast. Go to my website at clpowerauthor.com. This Sunday, September 4th, I'll be in New Glarus, Wisconsin at the Swiss Church Author Fair. It runs from 10 a.m. to 3 p.m. There's also an art fair going on. It's called Art in the Park. Please come over and say hi and buy some books. Have a safe Labor Day. My husband and I will be traveling the next few weeks. Don't worry, I'll be back for the October show. Thanks again. Cheers.